Welcome. Well, we still have people logging on, but we want to make sure that we value your time as well as the time of our panelist who is joining us from the East Coast, where it is 8 o'clock p.m. Um, we are going to get started. And again, welcome you to our program. Good evening again. Welcome to the 10th Annual Touro University California Social Justice and Public Health Speaker Series, hosted by the Public Health Program. My name is Gail Cummings, and I'm the Director of the Public Health Program, and I'm joined by Deirdre Wilson, who serves as the Chair for the Community Action for Health Concentration in the Master of Public Health Program here at Touro University, California. And together we coordinate and host the Social Justice and Public Health Speaker Series. Before we get started, we want to make sure we pause and reflect that regardless of where we are, we all are sitting on stolen land. The city of Vallejo, which is the home of Touro University, California, is on the ancestral and unceded territory of the Confederate villages of the Lejeune, Carquin, and the Patwin peoples. We also pause to remember that our country is built on the labor of enslaved people who were kidnapped and brought here from the African continent, and recognize the continued contribution of our survivors. And we acknowledge all immigrant labor, including voluntary, involuntary, trafficked, forced, and undocumented peoples who have contributed to building this country and continue to serve in our labor force. And as we do all of this work, it's our collective responsibility to pause and critically understand these histories, repair the harm that has impacted our country and individuals and populations for generations, and to honor and protect and sustain this land. If this is your first time joining us, the purpose of this seminar series is to provide upstream discussions around social justice and public health for students in our MPH programs and professionals in public health, medicine, education, pharmacy, and nursing degree programs, as well as for our community and global partners. And each year we focus on a different topic, and we are really excited this year that we've gone all the way upstream, and our topic is commercial and economic drivers of health and justice. So over the course of 6 sessions in this year's series, we will hear from leading experts across diverse fields of health policy, public health, history, and social science, who will help us understand the current commercial and corporate landscape, with discussions centered around how it has been developed, deployed, and the ways that it has undermined social justice and health equity. We have been extremely fortunate over the years to bring remarkable speakers to our series, and this year does not disappoint. We are absolutely thrilled to continue this tradition with our keynote presenter, Dr. Nick Freudenberg, who will kick off this year's series. And before we bring him on, I would like to acknowledge and congratulate our 2024 Social Justice Fellows, Kenna Williams, MPH student, Richmond Thaddeus Bandino, DO MPH, Manda Nguyen San, DO MPH, and an honorary fellow, Cien Javier, who is also a DO MPH student. All of these students have demonstrated their deep commitment to building leadership and advocacy skills to further the social justice mission of public health in our program, and we'll also be working on an episode surrounding these issues on our podcast, Socially Just. Now I'd like to turn it over to Dr. Wilson, Chair of the Community Health for Action Concentration.
Hello, everyone, and thank you again for participating with us this evening. We have a few housekeeping issues or things to cover for our students. This is a course that is offered to our public health students, and it's important that you understand that you need to log into your Canvas course to complete the requirements. This evening, we will hear a great keynote presentation by Dr. Freudenberg. But also we offer continuing education for our students who are interested and our community members that are interested. So there's continuing medical education, and there is also, and I'll provide these codes in the chat, there is also continuing public health education. And all of these links will be in the chat after in just shortly. We also offer micro-credential and badges for the Social Justice Speaker Series. So the Digital Badge Program offers a badge for today's session, but also for the previous 9 years, not quite 9 years, but since 2018, we offer those sessions and badges where you can register. This information will also be in the chat. In addition to the Social Justice Lecture Series Digital Badge Program, we also offer the Health Equity and Criminal Justice Microcredential and the Public Health Workforce Skills Microcredential. All of this information, again, will be in the chat. So now, let's introduce our keynote presenter, Dr. Nicholas Freudenberg. He is a distinguished professor in psychology, social welfare, and Africana studies at CUNY. He also directs the CUNY Urban Food Policy Institute and Healthy CUNY, a university initiative that promotes health for academic success of CUNY students. For more than 30 years, he has worked with community organizations, civic groups, and government agencies to develop, implement, and evaluate interventions to improve the health of disadvantaged urban communities. His current research focuses on the 3 areas: food policies that promote equitable, healthy urban communities, developing and evaluating intervention that enable low-income college students to overcome health and social problems that undermine academic success, and the impact on population health of corporate practices in the food, alcohol, tobacco, pharmaceutical, firearms, and automobile industries. He has authored several books on this topic, including his most recent, At What Cost? Modern Capitalism and the Future of Health, which will be the major focus of our conversation with him today. I'd like you all to warmly welcome Dr. Freudenberg.
Thank you so much. It's a pleasure to be here. Very nice to be with you all on the West Coast. I'm here at night on the East Coast. I'm going to share my presentation. So you can see, I hope, that this picture from Latin America says "Otro mundo es posible," another world is possible, and that is really the theme. Public health, to my mind, and health more generally, is about other possible worlds. And my topic today is how a focus on commercial determinants, which I'll define in a minute, will help us to find that other world, a better world than we're living in today. And here are some of the things that I hope you all will be able to do at the end of this session, which is to define this idea of commercial determinants of health and explain something about both its long-term and recent origins. That together we'll look at what is the potential of this idea of commercial determinants for informing the work of health professionals and public health workers, and what's the potential and limitations of this as leading to effective strategies to improve the health of individuals, but particularly of communities and populations, and to reduce the very stark racial, ethnic, gender, class, and other inequities that characterize health here in the United States and really around the world. In public health, in the last few decades, a lot of us have talked about social determinants of health. And I hope from today's session will understand some of the similarities and differences between the concept of social determinants of health and commercial determinants of health. I hope you'll be able to say something about what are some needs, both on the research side, the education side, and particularly on the practice side, both the healthcare practice and the public health practice using commercial determinants of health. And in the very particular for each of you, I hope you'll get something from this session that will enable you to do something when you go to work tomorrow or next week or next year different that will make you a more effective health worker, better able to contribute to the health of the patients or the communities or the populations you're serving. So that's where I hope we're going tonight. And I expect to talk for, 35, 40 minutes. And then I think we have some time for questions and discussion. And I'm really interested in hearing your response to these ideas, your agreement and disagreement, and any questions you might have. So let's start with some definitions. I start with definition I like for its simplicity that says commercial determinants of health are the factors that influence health when seen from the profit motive. In other words, it's looking at how profit, the quest for profit, influences health. An influential definition that comes from a recent series of articles in The Lancet prepared by a group that I was part of that was called the Lancet Commission on Commercial Determinants of Health. And we defined it as systems, practices, and pathways through which commercial actors, we'll talk more about that later, big corporations, banks, financial institutions, pharmaceutical companies, for-profit health companies, drive health and equity. And the last definition, which another group I've worked with came up with, and I'm an academic, and so it has a lot of words to it, but I think these extra words flesh out the meaning. And what we said, commercial determinants are the social, political, and economic structures, norms, rules, and practices by which business activities designed to generate profits and increase market share influence patterns of health, disease, injury, disability, and death, both within populations, in the Bay Area, in Vallejo, in New York City, and across populations, in the global South, in the global North, in low income and middle income and high income countries. And by the way, at the end, I will give you a list of some references for people who are interested, and I will be sending people the slides that will be available to those of you who might be interested. So those of us who have lived through the first few decades, the first couple decades of the 21st century, have just seen an extraordinary cascade of public health crises. I call them the public health apocalypses of the 21st century. Certainly the COVID pandemic, the worst infectious disease pandemic in the last century. But the climate emergency, you only have to turn on the television or read the newspaper every day to see how the climate emergency and the carbon emissions are affecting the health and well-being of populations. Today it's Florida, last week it was Tennessee, and who knows who it'll be next week. Some of you may have heard of deaths of despair, the rising rates of mortality, deaths, and premature and preventable illnesses among particularly middle-aged working adults. Deaths of despair are related to cardiovascular disease, to workplace injuries, to guns, to tobacco. And we've seen the death rates of certain populations, both people of color and whites, interestingly, one of the categories that affects all races, increasing in the last decade or so. We've also seen a rising burden of non-communicable diseases in both the global North and the global South. In most countries in the world, it's now the leading cause of death. And sort of associated with that is an increase in mental health problems, some associated with the COVID pandemic, but it really started before that. And the rates of anxiety, depression, post-traumatic stress here in the United States, especially among young adults, are growing. We've also seen as more and more workers are earning less than they need to survive, less than a living wage, a growing toll from precarious and unsafe work. And so we have to ask, we have to worry, those of us who are health professionals and public health professionals, what's coming next? And are we ready for it? And I think one of the ways we do that is we ask, what are the common causes of this cascade of disasters, and why now in the first part of the 21st century? And in my view, to understand this set of current public health crises, we need to look at changes in our politics and our economy in the period from, I would say, 1975 to right today. And people call that politics and economy different things. I prefer to use what I think is the correct word for it, which is capitalism, modern capitalism, 21st century capitalism, a system where markets look to maximize profits. And it's my view that the changes in capitalism since the 70s have contributed to these disasters. And I want to talk about what I think are the 6 drivers, those purple squares on the left, of this changes in capitalism since after the relatively more healthy period after World War II, when a lot of people in this country were doing better. Not everybody and not equitably, but a lot of people were doing better. So the first thing is corporate managed globalization. Our world has been globalizing for, a couple hundred years. But what's different about late 20th and 21st century globalization is there now 100, 200, 1,000, counting different ways on how big you make them, of corporations who are the deciders of how globalization is going. Their decisions about what to make, where to sell it, how to ship their goods, who to hire, are really driving globalization. And that's had a profound impact on the world. A second trend, and this is really in response to some of the changes from the New Deal and World War II through the civil rights movement and the period of Kennedy, John Kennedy, not his more distant relatives, and Lyndon Johnson, who instituted a series of regulations that actually protected the public from environmental threats, consumer threats, political threats. Since 1975, a lot of those regulations have been withdrawn. We've seen deregulation, and things that were in the public sector have now moved to the private sector. That's true in healthcare. It's true in education. It's true in public safety. And particularly true in housing. And part of the reason we're having such a crisis of affordable housing, we're having it in New York, I know you're having it in the Bay Area and other parts of California, is that so much of housing is now in the market economy, and so many people can't afford housing. And a third dimension of this changes in capitalism is the corporate control of science and technology. Louis Pasteur, the great scientist and the public health innovator of the late 19th century, said that science belongs to the people. But increasingly, new science belongs to the corporations that develop those science. And the intellectual property belongs to a corporation, not to Louis Pasteur or the scientists of today. And what those corporations use the science and technology for is to maximize their profits, to increase their control. And that means that although we have wonderful new discoveries in pharmacology, in medicine, in food, in many cases, that isn't available to the masses of the people because making it available to everybody is less profitable. The fourth trend is financialization. A growing part of our economy is now under the control of banks and the real estate industry and private equity. And that is a much more fluid economy than the economy that makes things, that makes cars and food and other things. And the financial sector is much more fickle, much more looking for short-term profits. They depend on debt, they depend on loans, and many middle class and poor Americans are now in debt because of the increasing financialization of our economy. Monopoly concentration is another 10. Most sectors of our economy in the United States are now controlled by 3, 4, 5 giant corporations. And as fewer corporations control our economy, they have more power to decide on prices, characteristics of their products, and so on. And it's more difficult for either government or for ordinary people to have a voice in shaping our economy. And finally, we've seen an increasing ideological dominance by business elites and market forces of the ideas that people have, the notion that that individuals are responsible, are mainly or solely responsible for their health, that markets are the proper solution to all problems. So these six drivers, in my view, have led to three things that are the underlying causes of the health problems we're facing today in 2024. They've led to an increased stratification by race, ethnicity, class, gender, and many other systems of oppression that characterize our society. And as people become more divided, the health differences between them grow. It's also led to a huge inequality in wealth. The top 1% and 10% of wealth owners in this country control much more than they did in 1970 or in 1950. And so they are grabbing for themselves the product of our economy and meaning that there's much less for the rest of us. And what that leads to in particular is that the necessities of life, food, clean air, housing, work, education are inequitably distributed, and those who are better off have more, and those who are in the middle or bottom have less. And so we need to ask, those of us who are concerned about health, what are the pathways by which commercial determinants, these corporations, banks, financial institutions, influence the health of individuals and populations? One of the ways I think about health is there these pillars of health, things that all of us depend on for staying healthy. I talk about 6 here. There are others as well. Food, medical care, education, work, transportation, social connections, how people connect to each other. And what I think we've seen in the last 30 or 40 years is that the big corporations have increasingly taken control of each of these pillars of health and modified it in ways that benefit them, but don't necessarily benefit us. So in food, we've seen the rise of highly processed foods, foods that are high in fat, sugar, salt, additives, preservatives. And we know a growing body of evidence shows that that diet, which now constitutes 60% of the calories Americans consume, is highly associated with cardiovascular disease, hypertension, diabetes, the leading causes of premature death and preventable illness here in the United States. That change in diet isn't because our tastes suddenly change. It's because the food industry produced different foods which were more profitable, more attractive in some ways, and had a very different health consequence. In medical care, we've seen the pharmaceutical industry, the healthcare industry, and the for-profit hospitals, as well as the academic medical centers who are often dominated by for-profit institutions, increasingly look to their profits rather than the well-being of the population. And for those of you who are clinicians or training to be clinicians, it dramatically changes the content of your work, because you're filling out insurance forms. You're putting every diagnosis on the computer screen to figure out who's going to reimburse for it and who's going to pay for it. More of your time is spent filling out forms than talking to your patients and listening to them and taking care of them. In education, we've seen the growth of a for-profit sector, and we've seen a very large industry that supports universities, and schools, whether they're public or private. The testing companies, the textbook companies look to extract profit from education. We've seen the rise of low-wage workers and the gig economy, Uber, Lyft, Grubhub, all those services that pay workers very low wages and really increase the stress, increase the conflict between work life and family life. With transportation, we've seen really over a longer period, a huge rise of motor vehicle transportation, contributing to climate change, contributing to traffic jams, contributing to road rage, and really an underdevelopment, because it's less profitable, of mass transit. We'll have to see how the push now to make e-cars will play out and what impact that will have in health. One of the very powerful predictors of health is feeling connected to other people. And through the big tech, through Facebook and X and the other big tech companies, more and more people are spending time looking at screens than looking at their friends. And that leads to less social connections. It leads to higher rates of anxiety and depression than others. So these are some of the ways that our economy has changed that make it harder for both individuals and populations to be healthy, and for those of us who are public health workers or healthcare practitioners to take care of the people we serve. And the way that commercial determinants of health influence health is by what businesses actually do. I was trained as a health educator, and we were trained that the way to improve health is to change the behavior of individuals and communities. And so what I learned about is, how do you get someone to quit smoking or eat a healthier diet or fasten their seatbelt or take their medicines the way they're supposed to? I think what commercial determinants of health practice says, yes, of course, individuals have a responsibility for their health, but so do the giant corporations and banks and commercial institutions. And I've come to believe that our work as health professionals and public health professionals is not simply to change the behavior of individuals, but also to change the behavior of corporations and business organizations. And so I've tried to understand what are the practices, the behaviors of businesses that lead to health. And so some of the business practices that those of us who are working in commercial determinants of health look at are marketing. How are products marketed and to whom? We look at product design. We talk about fast food. What products are used in them, and what motivates a company to design them one way rather than another? We look at where products are available. Do you live in a place where it's much easier to find unhealthy food and you pay less for it because that's more profitable for one sector of the food industry? We also look at investment decisions. Are there companies taking money out of our communities and sending it to Asia or Africa or Latin America because they get a higher return on investment and therefore putting people out of work, or investing in a company that will loan us money and then charge exorbitant interest rates? We look at merger and acquisitions, and is that going to make things better for the customers or worse? We look at patent protections. A lot of interest in patent protections in the pharmaceutical industry. I started my career doing work around AIDS and HIV, and at the time we came up with some of the first antiretrovirals, AZT and others, private company, Burroughs Wellcome and others, had a patent on those and sold them for $10,000 a year. And that's because they had the patent. And then there's, of course, corruption, another business practice that we see both in the political arena and the business arena. And then there's a set of political practices, campaign contributions, lobbying, public relations. So the notion of commercial determinants of health is, if we want to understand the health of a population, we need to look at the business practices and the political practices of the businesses that are shaping the pillars of health that I talked about a moment ago. It's a very different view of what health is and what our job is than simply taking care of the person in front of us. But I think the reason that some of us have come up with this framework is that the taking care of individuals, putting individual behavior at the center of our work, it isn't working. Business as usual isn't working. And what we've seen in the last 20 years or so is that the health of the population is getting worse, especially when we have the potential for it to get much better. And so the question is, what do we need to do differently? As well as the business and the political practices, there are also structures, things like the tax system, the trade agreements, the gender class structure systems. And these structural influences influence business practices. And the green box all the way on the right of your screen is what business is looking for. They're looking for higher profits. They're looking for more control. They're looking for lower wages, more favorable public opinion, stronger protection of intellectual property rights, and so on. And these goals of theirs are what drive their practices. And that's what we need to understand if we're going to have a comprehensive understanding of how to improve health. So I mentioned before ideological dominance. I don't know if any of you are old enough to recognize these two folks, Margaret Thatcher, who ruled Britain in the 1980s, and Ronald Reagan, who was elected president, a governor of your state, and then president of the United States in 1980. And these were some of the ideas they promoted, which have now become mainstream. Individuals are responsible for their health. Choice is the highest marker of freedom. Every individual should be able to choose to do whatever he, she, or they want to do. Government is the problem, not the solution, as Ronald Reagan said. Markets can solve health and social problems efficiently. Economic growth always promotes human health. Growth is good. Growth contributes to health. There's no alternative. Maggie Thatcher said, there is no alternative to the global capitalist economy. And in the 2020s, the new version of it that we're seeing today, democracy is for sissy men and cat ladies, another prevalent belief. And so we need to ask, as health professionals, how do these ideas influence the opportunities for health and disease, and what is our role in responding to these ideas? So I want to suggest some other ideas that I think can lead us to a different place. So I think there are two American traditions. There's one American tradition that, the market economy dominates and that individual freedom is the highest. And then there's another American tradition, is that collective action to protect the public against private interests is as American as cherry pie. Both of those are American beliefs, and we need to be influencing how we combine those two and who picks up what. Another idea is, instead of saying all taxes are bad, fair taxes better enable communities to deliver good health care, good education, to protect the environment, to protect public safety. And fair taxes are a good thing. Unfair taxes, where they burden the middle class and burden the poor, are a problem. But fair taxes are not a problem, they're a solution. Labor unions, that there's been a dramatic decline in the proportion of workers belonging to unions over the last 30, 40 years or so. And many people on the business side say that labor unions are not part of our society. But in fact, if you look at the history of the last 100 years or so, labor unions have played a key role in ensuring decent living standards and health for workers. And that's part of the American tradition too. I want to talk a little about a project we've worked on at the CUNY School of Public Health, where I work, around what we call predatory marketing of unhealthy products. And we call predatory marketing trying to sell products that we know cause poor health, whether it's guns or tobacco or alcohol or unhealthy food, and that marketing that to populations, to children, to young people, to people who are already vulnerable, shouldn't be acceptable, shouldn't be a part of an idea. And we at the Center for Urban Food Policy, where I'm now a fellow, I was the founding director, created a project to train young people to do counter marketing, to give very different messages out to their schools, to their youth programs, to their families. And we asked them to develop images and social media campaigns. And the two you see on the screen are ones that 14 and 15-year-olds created and then took to their schools. McDiabetes, I'm hating it. Just to make people think when they see the diabetes commercial on television or the sign on their street, that they think about a different way. And the other one about Coca-Cola, open death. And we found that the people who joined our training program joined it because they had family members who had diabetes or heart disease, or they wanted to protect their younger brothers and sisters. And so they took these messages. And it's a nice story because an elected official, a state senator, saw our campaign in social media, got in touch with us, and has now introduced a bill to ban predatory marketing to children in public places. And that bill is now before the New York State legislature. And then, as I think you got from what I've said so far, strong democracies promote and protect health. A very important idea that more democratic states have better health. States that spent less on health and gave people less voice in health had higher rates of COVID deaths than states that did the opposite. And the bottom line message is that another world is possible. So, change agents and strategies. These are some of the strategies used to reduce harmful business practices that harm health. Regulation, fiscal measures like taxes. Some of you probably know people have tried and in some places succeeded. Berkeley was one of the first to do it in putting a tax on soda. And in Berkeley, they got a majority of the population to vote for the soda tax because they put the target as Pepsi and Coke, the companies that were trying to make profits at the expense of the health of children and young people in that town. And the money that comes from the soda tax is used to build public drinking fountain in parks and to make healthier food available in schools. And there was public support for it. Philadelphia passed a similar measure. In some cases, people have gone to court. The master tobacco settlement came about as a result of a long period of litigation against the tobacco industry and ended up getting $270 billion from the tobacco industry to go to states to compensate them for what they had to spend on taking care of people who the tobacco industry made sick. And on the bottom of this list are social movements. And as someone who spent a lot of time studying the history of public health, it's my view that social movements, the labor movement, the women's movement, the environmental movement, the Black Lives Matter movement, the LGBTQ movement, have done more to improve health than what government alone could ever do, because they hold elected officials accountable. They put pressure. They hold out this idea of another world is possible. And so who implements these strategies? Elected officials, lawyers, journalists, corporate social responsibility groups, whistleblowers, professional associations, and you who are health professionals and public health professionals. And I'm hoping that from this series of sessions, you'll get some ideas of what can you do to take on these corporate determinants of health. What can you do in your clinical practice? What can you do as a voter and a taxpayer? And what can you do potentially as an activist? And so some of the ways that I think those of us who are health professionals can do is we can look for and take on the unhealthy the commercial determinants of health. We can talk about capitalism. A lot of people in health think that we shouldn't talk about capitalism, that it sort of has a taint to it, or it makes us look like we're old-time communists. But I think for public health and healthcare folks not to talk about capitalism is sort of like doctors saying they don't want to talk about bodies. Our political and economic system is at the heart of our pattern of health and disease. And if we can't talk about it, how can we expect other people to talk about it? We need to ground clinical practice, public health practice, and our political practice in the efforts of other people working for change, the community groups, the professional association, the social movements, the labor movement, and so on. We need to connect to those groups because we, as health professionals, can never do it by ourselves. We need to join with others. I think the current alliances between the movement for sexual and reproductive rights and healthcare professionals is a good example of how people together have taken on the repeal of Roe v. Wade, the Dobbs decision, and really looked to put that in front of voters, in referenda, in running candidates, and asking what is it that people want. Another thing I think we need to do is to defend truth in science. There's a new age that we're moving into where truth is whatever you say it is. But I think as health professionals, as scientists, as people grounded in research, we have to say there's a difference between something that has been established to be a fact and something that is our personal opinion. There are many things that are personal opinions, and we can have political debates about those, and people can articulate those debates. But whether or not climate change is leading to health problems, or whether or not tobacco, alcohol, and unhealthy food are contributing to the epidemics of chronic diseases, those are not debatable. We can differ on what to do about it, but to question scientific facts, to my mind, is contradictory to our ethic as health professionals. And finally, we can insist another world is possible. We can build new alliances. This is a picture of the Sunrise Movement that took the Green New Deal. They went into the office of Nancy Pelosi in, I think it was 2020, and they said, we want some new action. And a lot of people criticize them for going into a legislative office, but as it turned out, many of what they were proposing became part of Biden's Infrastructure Act, and some of it has been turned into legislation, and some of it has influenced policy. We need to start a respectful dialogue with people who might be partners with us, but who may not agree with us on everything. One of the mantras of the women's movement of the 70s and 80s is they were saying we need to make the personal political and the political personal. It's when people feel a problem is a part of their life that they become motivated to take action. And we need to learn how to do that, both for ourselves and the people we take care of. We need to focus on harm to the public, and we need to take a long view. I've been at this for almost 50 years working in public health, and many of the things that I thought I would never see came to be. The fact that we ban smoking in public places, the fact that it's now legal for gay people to get married. All those things seemed impossible a few decades ago. That we would have a serious discussion about racism in the political arena. Not enough, didn't fix the problem, but people thought that that wasn't possible. And for those of you who are younger than I am, which I guess is most of you, I urge you to have the patience and to take the long view. Sometimes it takes a while. And as I said, I think we need to move away from business as usual. We need to have a public health practice that goes beyond business as usual. We need to have a public health research that takes us beyond business as usual. This illustrates what I said before, young people who are spending more time looking at their screens than talking to each other. How do we understand that? And then how do we communicate it to people so that they're willing to move on it? And we need a public health teaching that goes beyond business as usual. This series of sessions that you're having today, where you're starting to learn about some of these thoughts and think about them and talk about them, is a good example of that. But we also need to ask who's getting into our schools of medicine and public health, and how are we ensuring that they're ready to take on the big, new, emerging challenges of the 21st century. And with that, these are some resources. I'll put some of these in the chat for you later. And with that, I also have my email here, and I'll put that in the chat if any of you have questions beyond what we have time for today. And I'm really now interested, when we get to it, of hearing some of your thoughts and your questions.
Yes, that was excellent. Thank you so much. You've given us quite a bit to chew on, to think about, and can I just say how appreciative I am, and I'm sure we are, of just being solution driven, because most of what you've addressed seems so difficult to, particularly as individuals and even communities, to be able to make a difference. That corporate steamroller has just rolled right along. And, as you mentioned, the idea of it becomes part of our norms. Well, we've accepted the fact that people have 3 or 4 or 5 jobs to make it. That's become a norm where we've all, kind of agreed. We've jumped on board with that. We've jumped on board with the idea that, education has become corporate, where, people are getting loans to send their children to kindergarten and continuing down this pathway. So I think it's quite powerful the way you've kind of put those into to framing these things that we've kind of accepted along the way. So I'm going to just start off. I have a couple of comments and some questions, as folks want to put some of the questions into the chat. I'm sort of struck by the term apocalypse. And I know you talk about that term in the book, and certainly you mentioned, the term capitalism, how that's kind of a dirty word a little bit. But, those ideas, those big ideas together, are just so powerful and provocative. And I'm assuming that the idea is that they're being used to capture the urgency, of this crisis that we're facing. How do you think that, using these big terms are kind of helping to frame this for the larger society, outside of, public health professionals?
Well, I think, first of all, recent public opinion data suggests that many young people are themselves questioning whether capitalism is the system that serves us best. So I think there's an openness to talking about it among young people. not all young people, but many more young people than when I was growing up, where it really was, people were afraid to use the term. And, people just a little older than myself had been victims of the, McCarthy period, where people were called up to testify and went to jail if they said that they had, beliefs of challenging the capitalist system. I think also that I think it's something that I believe about truth telling. There is a political and economic system, and if we put a label on it, it makes it less mysterious. There are characteristics, there are certain emphases on, on profit, on control. And I also think it opens a door to people who are defending capitalism to say, well, what do you mean by that term? And people can talk about there's not one alternative to capitalism. There are multiple ones, and there's not one form of capitalism. There are many. The capitalism that the United States had, in the New Deal or in the 60s was very different than the capitalism we had today. And if we're not willing to ask those questions and talk about them, we won't be able to come up with solutions. And I think the biggest reason why I think it's important to talk about, I think unless we as health workers understand how political and economic forces affect health, we're not going to be able to do our jobs of improving the health and reducing health inequities. So it's kind of, to my mind, imperative that we get a handle on those things. Sorry for talking so much.
No, I think that's that's really helpful for the conversation. And I think especially in public health, I think, for all of us, from different generations, got into public health as people who thought, being a health educator and really, focusing on individual behaviors was the ticket. But as you allude to, and as we are growing to have a better understanding of sort of these powerful structures and systems in place, are in control. We're not in control. The systems and the structures are those that are in control. So I think we've also, as public health folks who are from different generation, have had to change our framing of who's in charge. And I would put in the term, we're kind of being gaslit because we're told if you drive an electric car, you can solve solve the climate. No, that it has nothing to do with individual behaviors. It has to do with the industries, as you mentioned.
Yes. Or the way I liked it, it is both. And that when we talk about the individual behaviors, that can lead people into the political discussions. I'm doing this and this does, this much of what's needed. And if we want to do this much, we also need to do X, Y, and Z. I don't want to say to people, don't drive an electric car, don't, eat less meat. I want to say do that and something else. And for many people, the individual change can be a pathway into political and other forms of change. And that's, I think, why clinicians can be important, because we can help people understand that when people tell us they're making individual changes or considering individual changes, we can say, for the ones that are known to improve health, yeah, do that, but you need to go do more. You need to think about more, and here are some ideas.
Exactly.
So our participants have a couple of questions that are posted in the chat. If there are any other questions, please post them in the Q&A chat. That way we can take a good look. And so I'd like to go ahead and ask a couple of these questions, Dr. Freudenberg, and then we'll kind of sprinkle in a few of our questions as well. We have a question from Ashley Mustamid. And she says that it's very interesting presentation, and that you mentioned that you never thought you'd see a smoking ban in public, and we now have a smoking ban. What are the most realistic changes you think we can see, yes, in the lifetime of one of our students?
That's a great question, Ashley. Thank you for it. And I think that's exactly what we should be asking. And when I talk to my students, I talk about, combining incremental changes with transformative changes, what some people call radical incrementalism. We look for smaller changes that can lead to bigger changes, and we think about that before. I'm going to talk about one type of change that I've been thinking about a lot, and that is in several different of these pillars of health that influence health, to look to grow the public sector, the sector that is under the control of the people, and government, ideally, fair and democratically elected governments. So in food, a big portion of food is actually in the public sector, and it's taxpayers and citizens who pay for SNAP, for the subsidies to agriculture, for school food, and so on. And the public sector, where public democratic decisions can determine the content rather than food companies, could be a way to make healthier food more available, to reduce food insecurity. In New York City in 2017, after a long political process, the city decided to make free school lunches and breakfasts available to all million children who went to school in New York City. That was a really important move. Before, kids who were making a little more, whose families were making a little more, had to pay, and that made it stigmatized. So expanding school food, expanding preschool food, hospital food, senior citizens food, making food available, healthy food, affordable food in public places. And similarly, expanding SNAP. We saw a big expansion of SNAP in the pandemic because people needed it. And we saw that food insecurity went down. So growing that public sector on the agricultural side, shifting the subsidies we now give to people who grow unhealthy crops, sugar and soy, which is used mostly for ultra-processed food, to subsidizing small and middle-sized farmers who are growing fruits and vegetables and so on. That would be a way. I think similarly in the housing sector, investing public money in building affordable housing. There are cities that are starting to do that. We have a tradition of public housing that has been allowed to fall apart. So I think that's a change. And third, I think in the pharmaceutical industry, we could see increasing public control. There are some ventures that are creating nonprofit companies that, develop new drugs and then make them available at cost to people who need them, both here in the United States and in other parts of the world. I think that isn't overturning capitalism, it's creating an alternative. And I think if we can grow the public sector in several sectors, that would be one thing that we could see in our lifetimes, in your lifetimes, maybe not mine, your lifetimes.
Thank you. There's another question, Elizabeth Montedora. She states that it's sad the pharmaceutical companies seem to be kind of kings, and there's no money in promoting healthy eating. What can we do to help lessen the power of big pharma? And that, I think, is a topic that we've been very interested in as well, as we see the connections between kind of the food industries and pharmaceutical companies.
Yes. Well, I think there's some questions being discussed in the election 2 weeks from now. To what extent do we want the government to say to pharmaceutical companies, you can't charge more than this amount for drugs that people need? So I think there's also been political fights about intellectual property. Many of the drugs were developed with National Institute of Health funded research, research paid for by taxpayers like you and me. Should that patent go to the pharmaceutical industry who's manufacturing it, or should part of it belong to the government and they should have a voice in determining the price and the availability of that drug? So I think the notion that has actually in the current Biden administration has been a little bit developed is that the Food and Drug Administration and the Federal Trade Commission have an opportunity to take on monopolies, and monopolies are very apparent in the pharmaceutical industry. So I think those are important things, and you should look at the people who you're voting for and seeing what their positions are on reducing monopoly control of various industries, especially the pharmaceutical industry.
We have a few more questions we'd like to that are still rolling in. Daisy Amaya asks, how can data be better utilized to inform policy decisions regarding commercial influences?
That's a great question. Thank you. I'm currently working with a doctoral student in public health at Yale who is developing a checklist for looking at the commercial practices of the food and beverage industry. And her notion is to have, and right now there are many different measures that are used variably. Her notion is to have a single set of metrics, and that ultimately government bodies require food industries to fill out what their record, what proportion of calories, come from sugar and fat, who are they selling to? I think that monitoring of the business practices and making that available. Another approach has been taken in Chile, the country in Latin America, where they require every food manufacturer to put a red light, green light, or yellow light on every food product, depending on the proportion of healthy to unhealthy. And so that way, a consumer can go in a store, not have to read, the really complicated labels that are in the American system, but can just see those traffic lights and decide what they want to put in their shopping cart. That would be a great step forward. And some people have proposed that here in the United States. So those are just a few ideas that would help us to move forward. And then on the, I think our training of young people to be counter marketers, I think providing public funding to youth organizations to do counter marketing of unhealthy products, whether it's food or alcohol, so that there's a different voice. And I'll mention one more idea, and this comes from the tobacco industry. The tobacco industry, when the first evidence came about the harmful effects of tobacco, were required in their advertisements, their television advertisements, to give equal time to anti-tobacco groups, to the American Cancer Society and to other advocacy groups. And what they found is when other groups had a voice and could counteract the ads that the tobacco industry was putting on television, a lot of people quit smoking. And the tobacco industry became so concerned that they said, we'll stop advertising on television so that they don't have a mandate through the Federal Communications Commission to broadcast counter voices. Well, we could put something like that back in place, that if a television station or a radio station or a social media platform advertises an unhealthy product, they need to give equal time to people who give the other side of the story, so that we're all exposed. The sad truth is right now, the biggest food nutrition educator in this country is the food industry. That's where most people get most of their information about food. And if we create other public sector, school, community-based sources of food information and education, then people will have a more complete understanding of what their choices are.
We have a couple more questions. One from Sharina Salgado. She states that a lot of major companies do not like when they're challenged, and we've seen lots of examples of that. She states that locally, meaning Solano County, there should be a focus on prevention rather than treatments, but how can we shift the focus to prevention rather than treatment focused, given the power of like pharmaceutical companies and other corporate entities.
You're absolutely right, and it's a big challenge. In my way of emphasizing the positive, I point both to the tobacco settlement, where the state attorneys general extracted $270 billion from the tobacco industry and used it early on. Later, that money was diverted for other purposes, and that shows the importance of monitoring implementation of victories. But it was an important precedent that the industry had to pay for it. And I think that similarly, the huge settlements that Purdue Pharmaceutical has had to pay for its, really unscrupulous, shameful advertising of OxyContin, leading to, tens of thousands of deaths, is another example of our elected officials extracting money from people and then using that money to educate people, to emphasize prevention, to create street outreach, and so on. And we ought to be looking at that in the food industry too. And there are a number of academics and research institutes that are looking to apply the lessons from the tobacco industry and a little bit the pharmaceutical industry to the food industry, to say, if you make people sick, then you need to pay for that. Those costs shouldn't be put onto the people who buy your food or onto the taxpayers. You should bear them. Just again, to give an example of that, currently Pepsi-Cola and Coca-Cola can deduct every dollar they spend on advertising from their taxes because it's a business expense. Advertising is a business expense. So they're spending, hundreds of millions of dollars a year persuading people to drink their products that are known to contribute to diabetes, obesity, dental disease, and they're getting a tax deduction for that. Bills have been introduced in Congress to eliminate that tax deduction. The food industry is powerful and has opposed them, but you should be telling your legislators that you're in favor of that legislation, and your patients to be telling them, so that we hear a different voice. And it's going to take a while. It's going to be, you all can say 10 years from now, like I just did, whoever thought that, the food industry would be paying for taking care of people with diabetes and investing money in healthy food. But you, by what you do over the next 5 or 10 years, can lead to that outcome.
So, I have a question while we're waiting to see if any more participants would like to ask questions. And you bring up the issues of policies and voting. I mean, we have a major election coming up, obviously, in the next couple of weeks. But a lot of the policies that are being proposed, we're not in the know, right? And so how can we advocate for these policies, and where should our students and their community members seek information about what's out there so that we can contact our local senators and Congress people to encourage them to back what we want as voters?
So I think it's become increasingly difficult to get accurate information, but I think there is accurate information available, and we need to learn how to distinguish it from propaganda. I think I have a son who's an investigative journalist, so I speak highly of journalism, and particularly investigative journalists. There are now a number of places that do investigations of the health-related industries: ProPublica, The Examination, Kaiser Family Foundation, KFF. Those of us who work in health should be following those investigative journalism sites to read about their exposés. There are also, independent organizations that rate the party platforms and the positions of elected officials. There are, for some offices, debates, and we should be listening to those debates and, encouraging more of them. I think there's another set of things we can be doing in that arena. A friend of mine has become very involved in something called Vote ER, which is an organization that sets up voter registration facilities in emergency rooms and hospital clinics and community health centers. And not only does that make it, and you can find them online at Vote ER, not only does that make it one more place where people can register to vote, but it also provides an opportunity for health professionals to talk to their patients about voting and why it's important and why it has to, connect to their health. So I think all of us should be looking for all those opportunities to engage with our patients and the people we serve around the importance of democracy, the importance of voting, not just at election time, but year round, the importance of holding our elected officials accountable.
There's one last question that was in the chat that's related to housing. You mentioned in your talk kind of affordable housing and how affordable housing as housing is profitized in a way where it's become very unaffordable for many, especially here in California. We have a housing crisis, as you know. Jamie Rankin asked, how can we stop cities that may want to reduce or even stop affordable housing because of the stigma of people who may live there? And so there's some cities and counties who want to limit the amount of affordable housing because they want a particular citizen or a particular profile of a citizen living there. What do you think our students and community members can do to stop cities from enacting those kinds of measures?
Well, I think we need to get a message out that safe, affordable housing for everybody makes everybody safer and healthier. That if you force some people and you can push them around, but or you can threaten to deport them, but the reality of that isn't what we've seen. The reality is that people who are inadequately housed are living in terrible circumstances themselves and create not so much a safety threat that is, to my mind, a small part of the problem, but a public health problem because they're more vulnerable to COVID infection or whatever comes around. And so safe housing for everybody is good for health. It's good for well-off people, and it's good for middle-class people. There's a book called The Sum of Us by Heather McGhee that talks very nicely about how people benefit from working together. And the counter story she gives is in the aftermath of the civil rights movement, some towns closed their pools rather than integrate them, closed their public pools, just so that they would not be available to both white people and Black people. And so everybody lost. Everybody lost the public pools. That is the same thinking about doing away with affordable housing. Everybody loses. It makes the city less safe. There's a recent bill introduced in Congress by Alexandria Ocasio-Cortez and another elected official, I'm not remembering who it is, that would make social housing federally funded, which is something the United States did until 1980. We built a huge amount of housing from World War II till 1980. And then Ronald Reagan stopped funding for that. And that's when the housing crisis developed. In New York City, which also has a huge problem around affordable housing, the people who were homeless before 1980 were mostly older white men with alcohol or drug problems. And now it's women and children and families and migrants. And it's because we stopped building public housing. So we need to start that again and find ways to do it. And restricting the role of the big housing developers and private equity in housing, using public funds to invest in housing, as we've done in the past, as many other countries do, would be a step in the right direction. So we need to tell our elected officials that that's what we want from them and vote for people who support that.
Thank you so much. Dr. Cummings has one last question and we'll wrap up for this evening. Thank you so much, Dr. Freudenberg. We really appreciate this talk. It's been really insightful. Dr. Cummings?
Yeah, and yes, so many nuggets. I was really appreciating sort of you touched on predatory marketing, really also just becoming one of the things that we sort of accept. It's sort of like misinformation. We've become to just accept that they're different facts. And your recommendation that public health professionals, we really need to figure out how we focus on defending the truth, defending science, as one of our strategies to move forward. But my question was, you also talked about I love the example that you mentioned in Chile, where there was sort of the stoplights as sort of a means to evaluate the health of food products in Chile. And I'm just curious, it sounds like when we look at what's happening abroad, in Europe and in other countries across the globe, there seem to be really creative ways to kind of build in transparency. And I'm wondering if there are other models that you are familiar with that we might be also considering incorporating in addition to sort of the stoplight example that you shared.
Other models for getting healthier food.
Yes.
So one that I did mention before is taxes on unhealthy food. And there's now pretty clear evidence that they lead to changes in consumption. There's some debate about the fairness of them, and I think that's an important debate to have. But it's more unfair to impose diabetes and heart disease on vulnerable populations. And I think the taxation plans that use tax revenues to promote health, to make healthy food available, to create drinking water infrastructure, to do truthful nutrition education are much more likely to be accepted than ones where people see it as, an essential product. I also wanted to mention something that London did, the City of London, which is they banned any advertising of unhealthy products aimed at children in the public transit system, in the buses, subways, and so on. And that was instituted. And the notion was that you were forcing kids to look at things that would contribute to poor health, and that wasn't fair to do to children. And there was recently a study done that showed dramatic reductions in the consumption of unhealthy food in London after the ban. And they were able to compare areas served where the ban was in effect to areas outside the border of London that were served by the same transit system, but that ban wasn't in effect. A very powerful study showing that just limiting the exposure. And there's a word I wanted to maybe end with, because I think it's a good word, and it came up again from the tobacco control movement. It's the word denormalize. What we want to do is denormalize unhealthy, untruthful practices. And what we want to say is trying to sell kids foods that's going to make them sick and die early, that's crazy. That isn't normal, and we shouldn't allow it. And I think all the things that we've been talking about, making essential medicines so expensive that people can't afford them, that isn't right. It shouldn't be normal. And we, as health professionals, can help to denormalize those practices. And it used to be normal to smoke in public, to smoke inside. It's not anymore. And it took 20 years to change that, but it was the work of health professionals and activists who led to those changes. So I think we can play an important role every day in making that change.
Thank you again, Dr. Freudenberg. This has been a great kickoff for our 10th annual Social Justice Speaker Series. This is our anniversary year, and we are very excited to start to examine these issues of the corporate influences and corporate drivers health outcomes. So thank you again for kicking us off and giving us some great information to really get us started on our way. So to all our guests, I have put links into Dr. Freudenberg's 2 textbooks if you'd like additional information. There are also many numerous articles that can also give you additional information. So thank you again for your time.
And thank you for all the work that you do in this area and helping to frame these ideas with solutions for us to consider from public health. We greatly appreciate it.
And thanks to all of you, and the very best of luck to all of you who are working in this field. And I hope something that we talked about tonight will help you in your work, as I said before, tomorrow or next year. Good night.
Good night.